Dr. Nitha J, Dr. Ravi Sankaran, Dr. Neena, Dr. Sindhu Vijayakumar, Dr. Vaibhav Lokhande.
Hello. Yeah. First of all, it's an honor and a pleasure for all of you keeping up all your difficult the jobs out and coming up for this event. So that thanks from my side and the team of Genrobotics. So we do this event as a part of a big initiative. In fact, the general idea of at Genrobotics we believe in betterment of humanity through technology. And that is only possible when we know how. And this how comes from the real people out there, the industry experts out there like you, in terms of health, the doctors like you. So we always valued, when we give a promise, like our CEO said, we will always strive to bring the technology to you. That promise is only fulfilled, we all know that, when the inputs, your mentorship comes through and comes to the world. And that we become a platform for your expertise to bring it a reality, just like the G Gaiter Paediatric. This is one more example. So that is the general idea of this kind of events, which includes the panel discussions, podcasts, testimonials, even the patient testimonials for the matter. So this even helps us, the global public, the community, to understand the importance, realize the need, and work in a focused manner. So it's like a light-bearing sessions. So thank you, and we can start without any further ado. So to begin with, the general idea of this discussion is specifically to understand and share how technology have helped in rehabilitation, physical medicine in general, technology in the sense robotics, AI, VR, there are a lot of them coming up. So how all of them are helping in present day. Each and every one of you have been experiencing these things. So we would like to know more about that. And what is the next right step in the right direction? That guidance, which again helps us to stay more focused and bring out the things that we need most for the community and the globe. So to set up the stage, I can start from, I think, in an a line order, where we can just begin with, not make it too formal or something. We can make it casual and begin with sharing some of our experiences where technology has made an impact or brought some more efficiency in our real life experiences. Starting with Nitha ma'am.
Thank you, Arun. So, how robotics impacts rehabilitation?
Yeah,
That is what you
physical
meant.
medicine, yeah.
Okay. Why do we need robots? We have a lot of professionals. So, do we actually need robots? So, if you look at any production unit, it is all mechanized because the mass production has to happen. Like that, when you have a stroke or when you have a brain injury, to bring about a response, we should have that much mass practice. So robotics is a wonderful device to bring about that mass practice with little effort from the therapist. Supervision is needed, but the physical efforts can decrease. Then comes, why do we need robotics in surgical practice? It is the precision. So if you combine the mass practice, precision, and if we can give feedback, then robotics is a wonderful tool in the hands of a physical medicine and rehabilitation specialist. How does it impact persons is somebody who cannot stand after an injury. They want to experience the standing, they want to experience walking. And like G Gaiter, the gait training robots helps us to actually initiate that gait training or initiate that walking process in a very early stage. So both emotionally and physically and neurologically, definitely it impacts the functional level of the patients. Thank you.
That it is there. And also many other things couples up into it, like the biofeedback. And so I think others can also add up into the points.
Just thank you, Arun. Thank you, madam. I just wanted to tell the one thing what I feel many investors asking that India is a 100 crore population. We have so many people. We have, instead of taking so costly equipment, we will give you more manpower. that we are not dearth of physiotherapists or physiotherapy assistants, or instead of you are having so costly equipment, why you are not using manpower more? So it is a simple answer, that quantification of data, quality. I came today, yesterday Trivandrum with the air travel. Instead of air travel, I would have used the car also, would have been used the train also. The patients who are in the next generation of India demanding the high quality, early recovery, and how much is effective utilization of my what you call, even in terms of layman language, that my insurance money or something. I just wanted better treatment. It is just technology is changing. Previously we are operating, the eye operations are doing the with sutures. Now with FECO, we are able to give the patient discharge within 20 minutes. The same thing with better equipments, we can send patient back home with the early days. He can enjoy his rest of life with his family in more qualitative time. That was my actually take on the new generation equipment, robotics also, that we should focus on technology and plus manpower development hand in hand. We cannot depend solely on only manpower training, or solely depend upon the just we want to educate our population or our junior staff and they will take better care of patients. But in when we use robotics, when we use AI, we are just helping patient to have better recovery. It's just time we are saving for the patient and giving the quantifiable data, that yes, you are this stage at that point, you are now in this stage, which is very difficult in previous era with the only we are doing with the hand driven practices or what we call traditional practices. That was my actually add on point. Thank you.
And
I very pleased to be here on this
you.
occasion, as
And we are.
yeah, because that was one of the first things when I came. I saw they had their adult G Gaiter ready, and this one small device was there. So I just asked, like, "Is this your pediatric device?" And they said, no, this was our like first version. I said, why don't you convert it into your pediatric device? You know, then I'm really, really happy that it is materialized today.
Nearly a 2.5 year long journey.
Yeah, and it has taken that long. So, in terms of what you were talking, like technology in rehabilitation. So, I have never been tech savvy. I don't know much of technology, just learning medicine and doing rehab. So, but when it comes to rehab, or if you go to the gym, how long do you have to do to develop your muscle? You have to really push hard and do so many multiple repetitions. You got to go for months. Only then your muscle power will improve. But for a person who's had a paralysis, for that recovery to happen, and not just any neurological condition, even with severe medical conditions, you're not able to do. So I recently have a neighbor and a patient who has had a liver disease, but he's been in bed for so long, he's had dialysis, he's not able to walk. Very simple, like just like the example Ravi showed, cardiomyopathy, that like you chose an option which is there for neuro patients, but then you give this and then she improves. So that's how I see it. It doesn't matter what the diagnosis is. Wherever we can give a gait pattern, a movement. So I don't have G Gaiter, but I do have the simple robotic hand, and I go and give it to most of my stroke patients. And I also substitute it for the therapist, because therapist can only see so many patients in a day. So I do have limited number of therapists. So I do tell them, at least the robot you give 2 or 3 times in a day. So that does all the passive movements along with the patients and the bystanders. So getting those multiple number of repetitions is what you can achieve with the robot. And not just the robot, anything that can in the technology where there is visual feedback, where there is a gamification. And I initially wondered about the geriatric category when they came out with one of those balance trainers, very static, just one games. I was very doubtful, like, is it going to work at all? But then to my surprise, most elderly patients, they were happy to stand on that, have a game, stay on that game, just to show how to bear weight on the leg. It was much easier with the feedback rather than just telling them you put this weight on this much. And, so it makes it very simple to explain to
Especially
patients.
for the patients.
Yeah,
Geriatric
whether
case.
it is geriatric, whether it is pediatric. So I think across the age groups, the technological advancements, if we can translate it into what we need, then that makes it really much more acceptable, easier for us to connect with patients, and of course, they can see their improvement in real time.
That is even more important. The seeing the
Yeah,
improvement.
seeing that improvement. Like yesterday, I could only do this much, and then after 3 days or 4 days, I'm able to do this much. So that makes a lot of a positive change.
True. And Neena ma'am, yeah, you've been from NIPMR and your perspective there.
Thank you, Arun. Actually, I'm coming from NIPMR. Some of the practical difficulties that we are facing at NIPMR is we are having a cerebral palsy school. So we have 40 to 45 students in that school. And we have around 9 to 10 therapists also. But our therapists are not able to give proper training to the school kids because of the patient load. So parents are always worried that our children is not getting therapies, they are not getting gait training like that. So in such a setup where the patient load is very high and the therapist number is very few, the robotic system will be very, very helpful because it will maintain their general health. Okay, and there is a period when the pediatric goes into adulthood, the transition to the adulthood. So what I have noticed is the most neglected area is that period, the transition to the adulthood. The pediatric people won't look that patient. The adult people also will not look the patient. So mostly they go neglected. So the maintenance of their health is very important, especially cerebral palsy kids. So their general health, their bone health, everything can be maintained if we have a robotic system with a few therapists and huge number of patients. In a low level setting, such a system will be very helpful. Only thing is in government setup, the funding and all those things are very difficult. And even I studied at Government Medical College, Calicut. There also we have a lot of children who are not getting the proper rehab with a very technology assisted rehab. We are running far behind. The medical colleges are actually running far behind, especially in the rehab field.
Yeah, and we will change that.
Yes,
Yeah.
thank you.
And that is why even health ministers are participating with us.
Yes. They should. They are aware because of our so many constraints. We are not able to put the technology into it.
Rightly, ma'am, rightly. And that is one more reason to spread the awareness like in the events like this.
Yes.
Yeah, and Ravi sir, your perspectives, please.
So I believe the question was not just robotics, but technology.
Technology,
I want to
yeah.
expand a little bit then.
Yeah, please.
For better or worse, we're in an age called evidence-based medicine. Evidence-based medicine is population medicine. Population medicine means general statements that can be applied to every single person. So the value of technology in evidence-based medicine then is standardization, quantification, and reproducibility. All the variability that would come into care by having people provide the care goes away. And now you can standardize what's happening. Meaning if you do this thing, you get this result. Every patient wants to know that. How much should I do? How much do I have to spend? What can I have at the end? 1. 2, quantification. It's not one therapist sees one day, someone else sees another day, the physiatrist sees once a week. The machine will tell you, on this day they did this many steps, they gave this much resistance, you can go to an active mode or a passive mode. We recently had this with that boy I showed with the brain injury. He started walking in the G Gaiter very well. Then we found his neck is dropping. So we put a collar on. He started walking well again. Then he started holding his knee in flexion. And the machine could not overcome this. So now we're stuck. What do we do with this guy? We're charging him for this service and he's not getting better, right? It turned out his neck was so extended, his toes were curling on each other. And that was making his knee flex. So a little bit of Botox stopped it, right? So he went back to walking well again. And of course, this week he showed us a new thing where he would walk like a board. he wouldn't move at all, right? So again, it was just adjusting the neck. But again, because so many variables are controlled by the robot, everything is standardized, so now we can work on the smaller things. And he's making gains because of this. One. Two, so that's quantification, sorry. And then reproducibility means if you can show a standard gain in this many sessions, you can now reproduce it somewhere else because the variability is gone. And that is the value of technology, be it robots or AI or telehealth.
Wonderful, sir. So that is again a very strong point out there. The impact has been being proven day and after day after day. So that brings me to another one point. How we all talk about that robotics and technology. When we bring in technology, we bring into the clinic. This is something I usually talk a lot with Ravi sir, especially, and Nitha ma'am also, because I used to meet them a lot. So here, how can we bring the technology to the home? Now, it's a new era where medicine is going to the home, care is going to home, telemedicine and all those things. So I think again I will start with Nitha ma'am because she has been waiting to answer, I believe. So yeah, here going ahead, I would like to know what next can do in terms of technology on robotics itself. How can we go to the patient's home and have a connected healthcare where you can do the rehab and things in home at the same time, give the same impact when you have the patient in the clinic. So thoughts on that, ma'am?
Same impact as a rehab center, I don't think that is possible. But robotics can definitely help home-based rehabilitation. So right now we are actually successfully running a pulmonary rehabilitation on tele basis. I think when we think about neuro rehab part, especially the geriatric people, we have a lot of social assisted robotics, mainly in the hospitality industry, and even I think FDA approved for Alzheimer's also.
Oh yeah.
Okay, so there are even pet. Japanese has a pet.
Robots.
Yeah, it's a pet. This one that called hippo-like thing.
Okay, okay.
Okay. So the geriatrics, what happens is they requires actually assistance for most of the things, especially when you have a neurological part also on the top of it. So if we have a robot who can actually assist the person in getting up, be a companion, and helps them to have a better social interaction, gives them a more privacy for maybe her toileting activities. All these can be done by a social assisted robotics. It is easy to tell, but it is multifunctional. Yeah. So not that easy because it's not just a companion, you require that physical support also. So such, I'm just quoting an example.
Understood.
So robotics at home, there is a lot of options. Lot can be done, especially when it comes to rehab part. I think social assisted robot is one thing which I would like to see.
Definitely. And the next, I would not like to pick names here, but yeah.
I feel that rehab at home, next generation is via CCTV, AI, power enabled, how they are doing it post operative or post rehab. We can just monitor, and once the 1 month data or something comes, the report that patient is having more frequency of fall or he has losing his balance, like diagnostic way we can utilize our next
like
generation.
A monitoring device,
Yes,
continuous
yes.
monitoring.
But therapeutic, as ma'am has said correctly, we can give better services at center or hospital because we have manpower who are trained for that. And in new generation AI devices for the monitoring the heart rate variabilities, sugar levels, will help us to give the better analysis of the patient, how is he improved or whether it's worsened. That take on this.
Right. Yeah.
Yeah, I would say, like I can look at it in many different ways of having this.
Very large.
It's a huge area to explore. So as Nitha said, like pulmonary rehabilitation during the COVID times is something we all considered, like tele-rehabilitation, where patients are not able to come to the clinics. And that's when we all explored all the possibilities of teleconsulting, telemedicine, tele-rehab, teletherapies, all those we explored. Some were good, some were bad. They were both good and bad things. I think what I have learned is that I don't have to insist on every patient coming to my clinic. Yes, definitely at some point I need to do a physical examination, but then a lot of history could be taken over the telephone, video consultations, watching them at home. So that was one aspect that we explored, and it was quite good to have that. For follow-up patients or those whom I've already assessed, and to offer continuum of care, that was much easier to do. So that is something we all explored, and we were involved in developing some of this programs, therapeutic programs for people. I was very skeptical about it, how to give an individualized program for each particular patient. So I was not in favor of offering, these group therapy programs, where I believed that every person's prescription need to be different. But this ongoing care, like once we have devised a program, and if whether they are able to do it at home, monitoring at home. So if they have a similar system, there are already such systems like Kinet systems and all existing, where technology is building up, where the patient can connect their particular things to the USB, to the smart TV, and they can do the exercises at home. Somebody else, a son abroad, can monitor their therapy. So all these are happening at some levels. But to take it to the next level, how can you do? I would only say, Nitha already talked about the socially assisted robot, and you could also have smaller exoskeletons or other systems, passive systems. I'm not sure. Like there are so many ways in which you can do. You can actually monitor their therapies. So yes, I would. We are already doing speech therapies online, so you could give them more programs. Many people, I tell them to convert one room into your therapy room, so that you do it like you go into that room, you have to do your
Something like
therapies.
a home kind of gym or something.
Exactly, something like a home gym, especially for kids. We suggest at least you convert one, especially for children with autism spectrum disorders.
We live in a day where people are converting homes into ICUs.
ICU. so yeah, and that is another thing. Those bedridden people, or those who require high demands, they are on tracheostomy for a long time. They've been on ventilators for a long time. They can still live at home, and if we can give something that we could monitor them remotely, and they do their stuff at home, it'll be great. Yeah, so that will expand our horizons much more.
True. The area is vast, so we should focus on one thing we can do fast and best, and then expand on that.
Expand on that, yeah.
Ma'am, Neena, ma'am.
Actually, robotics at home, as madam said, it is a very vast area. So it is like rehab, it is not specified to a single area. It covers a lot of domains. So especially I think geriatrics is the next area which is booming now, because the geriatric population is increasing now. And the caregivers, now every aged person, they will have a caregiver. So you can think like a robotic assistant, rehab assistant at every home, because the population now we are having is the geriatric area is more. So that area will be a beneficial one with
or at least a device to guide the care.
Yeah, a rehab assistant or robotic rehab assistant.
Something like that. We will definitely bring it. And Ravi sir, yeah.
So,
I'm very excited.
for me to talk more, huh? You asked a question, how to make it more accessible, right? That was your question? So put on a truck. Put on a truck, put hydraulics on the back, let it lock into the ground, and let them walk outside the truck. And that's how you do it. And the thing is, when you look at a state like Kerala, we're not a poor state, just we have 50-50 urban-rural ratio distribution, right? So those who have access, have access. Those who don't, they don't have an issue with that much money, just they can't get to the center. You put on a truck, you take the truck to them, and then you see what happens. Because what you see is it's no longer an issue of have and have not. That's poverty and being rich. It's more of need or need more. And what does that need more? It's not the therapy, but actually a medicine doctor like us to look and see what's going on. Why are they not able to do what everyone else can? So that's part of it. Doing this will exacerbate the situation by exposing who's going to benefit and who's not, but it won't be people deprived of care because of accessibility issues. the bigger issue that was not putting it into a truck, it's transitioning this into participation. So they get on the truck that goes to their local government hospital, they get the sessions. What do they do with it? Do they walk into the next wedding? Do they go to church for Christmas? Do they walk to the mosque or not? And that's how you make these things succeed. And if this can be done in a place like Kerala, our roads are pretty crappy, then you can do it anywhere else. And the government can actually see a model that works and work from it from there.
I remember when you told me that we can put the G Gaiter on a bus and send it to the home. I think it's about 1 year back or something. Yeah, casual discussions. Yeah, and sir, I will start with you on a specific topic basically. As I was going through your LinkedIn and I saw that you have been MH Kirki and sports and army together. So that drives me a lot of curiosity. I have to learn a lot from you on that part. So, I believe there could be a difference being treating a normal person or an athlete or a soldier to when it comes to rehabilitation, because they might not be just wanting to walk. They may be having a feeling of get back to what they once had. So, what do you feel in that aspect, sir?
Thank you, Arun. This is very important topic. Since we have more than 18 lakhs serving and same amount of pensioner from the army, defense forces, air force, navy people, what major challenges what we saw that once they are had an injury or something, they drop their ability to work in the particular field area, field hospital, in remote area, because they require a lot of strength, endurance, and they wanted to get back in the service as early as possible. And with the help of certain robotic equipments, we have seen in Pune, in even in MH Khadki, ASI, Army Sports Institute of uh, Sciences, what I seen, the what intensive, if you do rehabilitation with the specific equipments, they have recovered very faster than normal public, because in normal public, yes, we do exercises, but not as physically fit as any army person. I personally feel we have to get back to certain upgradation in the equipments, in the training protocol with robotics, particularly designed for army people who are serving or who are retired. I think there is a difference in the utilization of equipment protocols will be little different.
So, customizing them for the
Yes,
unique
yes,
needs.
definitely, definitely. Their need is different. Their what we call service responsibility is different than common person. Maybe even if I don't run for my job to catch a train, I am anywhere, I may be able to survive. But if they can't able to perform the certain task in the certain field area, they may be, then they have to take early retirement. It is a huge psychological, physical, emotional loss for that person. I personally feel that as early as the utilization of advanced technology, advanced training protocol, it will be better.
Wonderful, sir. And coming to another specialized customized care, I was thinking about Neena ma'am's point of about having autistic students there. So, like we are talking about robotics, and what about another specific technology like AI and VR? This could be a very communicative transformation. It can act more like a bot or a partner rather than being a therapy. So, in building that child. So, how do you feel, ma'am? Like, how do you think that there is enough scope in there? And could you just give some small examples also?
Yeah, sure. Because at NIPMR we have autism school also, and many kids are having communication issues. But when we use AACs, augmentative alternative communication devices, they are able to communicate with us. They are able to express their needs. Sometimes they will get frustrated once when they are not able to communicate their needs. So normal communication means may not be possible for them. So they always need an alternative method. So in that field, actually, a lot of research and new innovations has to come to help them out in their communication, in their daily activities, and getting them more socialization for those kids. So not only autism kids, cerebral palsy kids also having communication issues, they will also benefit from these innovations through AI or VR mediated.
My software team has to take note on this, all these things, yeah. And yeah, I think this is a really important and big topic. When we have launched something pediatric robotics, there is even more scope in building new things into it. So yeah, any other thoughts on this, ma'am, before going to the next topic? Yeah, Nitha ma'am, you, yeah, Ravi sir, anybody, please.
Regarding autism,
Oh, autism and AI and VR specifically.
when it comes to pediatrics, AI and VR, I think it's an integral part because
part.
it's all about play. They don't want to do therapy. They just want to play. And whatever technology we can incorporate for getting that outcome, this it definitely helps. And a lot of instruments are there, actually, equipments are there. Robotics as such, specifically for pediatrics are less, but AI and VR wise, there are a lot of equipments.
Right.
And a lot more needs to be developed in that,
And combining this also has a lot of potential, I believe.
definitely.
And you have to be in touch with the latest games that are available for kids.
True,
You know, you showed about the shooting and the
Maybe Candy Crush
and the
or
Candy Crush. No, not Candy Crush. It's not the era of Candy Crush anymore. It's like what we old people play, right? And my kids ask me, "Are you playing Candy Crush?" Like it's all those dressing up and what is that? There is some Roblox, and you get you rob the bank for
FC
pleasure.
football. FC football.
Exactly. And
like
so,
PUBG or something maybe.
yeah. or for the girls, it's like those walking on the ramp, the fashion shows. You design it's designer kids, and there are so many things. Like my daughter the other day said, "Come, let's go and rob the bank," and I'm like, "What?" Like it's the game that they are playing. So yeah, you have to be in touch with all these things.
You have to understand the pulse of the children before making those games.
So if you are if you are designing something for the kids, you got to know what they are also interested in, what the similar age kids are doing in school, their curriculum, and those are things that you can get tips from, and that can be incorporated into the systems.
Right. Ravi sir?
So I don't do autism enough to give a proper answer, but I think it's always about the goal of care, right? So if you look at autism, if they are high functioning, it's to get them to behave in society in a way that is acceptable for everybody while they enjoy being a part of society. If they're not going to reach that, it's so they're not being a problem at home. The fundamental problem I find with all this technology is it's made, it's shown, it's marketed. Does it equate to real outcomes? We don't actually know. It's just there's a kid with autism, it's decided nothing can be done with them, make them do this. What comes out of it, finally, no one knows. But I think when we all sit together like this, now you get to hear what we actually worry about. As doctors, we're going to take money for a service. If we give nothing in return, that's horrible, it's unethical. You don't do that, right? But then the question is, what is the reasonable outcome? So when you have AI, virtual reality, teaching people what and what not to do. We have a colleague in Koilandi, and she works in a purely autism school. And one of the things she had to teach the boys was not to touch themselves down there in public. Or what is decent, what is not decent, because they know what they want, they know how to get it, they don't know what is appropriate to do in public or not, right? So,
appropriate or not.
Yeah, and there's a lot that has to be done in that way just to get these people into mainstream so they can enjoy life. The complexity of the human brain is the interactions we have. All of you are probably having a hard time with my accent. I'm sorry, I'm wired that way, right? But then these kids don't even have that. They might think it's okay to make monkey sounds in public when it may not be. But when we gear technology towards these kind of hard outcomes where this kid tried this and he actually can do this and now look where he is, his brain is wired differently where he can focus very deeply on something and really do a wonderful job, but can he show it in the real world? We don't know. And if we don't do that, you have people who get exploited in real life. They're geniuses, but they can't show it. Someone who knows how to market on that and makes money off them and they get abused. That's all.
Yeah. So So I think that is the list of topics I have thought out, and I would like you to have anything to add on from your perspectives.
I think we should bring down the cost of technology.
Yeah, that definitely is there, because that is what our half of the team is working on every day. Because unless it is affordable and accessible, it is never a right innovation, I believe.
Actually, my dream is to your innovation should reach to the lowest economic status people, because they should be able to use such great innovations.
True, ma'am. True, true.
I think what ma'am says, I also agree. Utilization of that technology within 1 year, 5 year, and maximum people should get in all category. It's not only those who have the affordability, insurance backup. I personally feel that technology becomes so cheap. Like car, give example of Maruti 800. Previously, we have waiting list for 3 years to get a car. Same thing, certain people or certain hospitals only can offer the high-end technology, which is I personally feel in India, like Dr. Ravi sir is saying, that sometimes we have to draw the boundary, ethical and unethical. We should able to use this technology to all kind of patient. That is my next 10 years in India, that affordability and accessibility to all kind of people.
Definitely, yes. Yes.
Apart from accessibility and affordability, those are important aspects. What I would also look at is to have clear-cut guidelines, whom to use, whom not to use, and where to use, where not to use. You know, what are the contraindications, like where is it that we should be careful about? Because once something like this comes up, everybody would want to see. But to set those realistic goals, what is the goal of starting a rehabilitation or robotic gait rehabilitation therapies? Where do we achieve? Where do we go from there? Like there may be 100 patients who would be waiting for it, but who is going to really benefit out of that? Those are probably our responsibility as treating doctors. We should be, developing those kind of systems where we know if these criteria fit in, this patient may have more benefit, and so then we may be able to choose more appropriate patients for robotic rehabilitation. Because I do remember one of the children when I started off at NIPMR, there was this boy and his parents. He was around 10 years old, muscular dystrophy. Is there some way that my son can walk? So, and then at that time I just said the only way out now is robotic gait training, where I could give you exercise walking, not real walking. He is not going to ever regain walking. So those are realities that you have to, like in Kerala, I think that is one of the problems. Like one person walks and then everybody thinks everybody can walk. You know, a spinal cord injury person might definitely walk. And even without robot, he would have walked sometimes, or maybe not, or it was this. But then a muscular dystrophy patient walking on his own is not going to happen. A spinal muscular atrophy person is not going to walk in real life, but simulated walking. So I keep telling all my patients, I can give you assisted walking whenever you want. You know, I can make you walk with assistance, or exercise walking is something I can do for you at any time. But walking outside of the robot, is it going to happen or not? Those realistic goals have to be set very clearly, and PMR, physical medicine and rehabilitation in general, needs to be out in the public, and they have to know the potential of what PMR is, the prognosticating. Yes, the prognosticating, who is going to benefit out of it, giving a trial. So now what is happening is more of therapies and therapies without really understanding the medicine behind it. So a change from that scenario is what I'm hoping to establish. Meeting better systems, making better systems is what I'm really hoping for with robotics coming into PMR.
The same thing I have to add, like Madam told. Once a muscular dystrophy patient asked me, Madam, is there any way so that I can stand or walk? Is there anything that you can help me with for me to standing or walking? And he is bedridden, he is in wheelchair bedridden. Muscular dystrophy, it is very difficult. So a single therapist going to his house can't make this patient stand or walk with his alone effort. Okay. So in such cases, muscular dystrophy, I think robotic system will be very helpful. but we have to explore. Therapeutic standing and walking only can be given, but that will give a huge satisfaction in the mind of the patient that I am standing, I am doing gait training. That will give a very good satisfaction for the patient.
So may be able to prevent a lot of anticipated
yes,
complications. Maybe may be able to prevent a
Won't
lot,
help,
but that is all is what we need to convey to the masses. Yeah.
Right. Sir, and
Raise the question. I'm a little bit lost.
there are no questions now.
No question.
Yeah.
It's your opinion on the future or
On the
In
future.
general, yeah, something for you to add.
Give me a question, I'll give you an answer. Otherwise, I have nothing to say. What's the question?
Like, I'll bring up a random question. Yeah. For your clinic, as of now, you have G Gaiter right now. What will you add next?
Something for the arm.
Something for the arm.
Yeah.
Yeah. And like the specific importance of that for that people may not know.
Yeah. So, when a person has an injury to the brain or the central nervous system, they lose either half of their body, all four limbs, or their lower body, right? So we call those corticospinal tract lesions. So robots that make them walk help them walk, right? Walking is important for all our daily activities. That's why we're all here, right? The thing is, recovery for walking happens almost on its own, just not in a proper way. The hand is the hardest thing to rehabilitate. What we take for granted with all the tiny gestures we do has a big part of the brain that's wired just for that. And because these people have tightness in their limbs, they can't use it the way they want to, it affects everything else. So the question is, what's next? It should be the arm. Why the arm? So they can regain their daily activities. I had a principal of a school from Maldives come in 2 weeks ago. So he was a tour guide for a lot of Maldivian people in a hospital in Coimbatore, and along the way he had a stroke. Why, we don't know, but it was a very small stroke. So he should have recovered everything, but he's still hemiplegic. Now, the guy is determined. He loves his students, he loves his school, and he walks 1 kilometer to school every day despite being hemiplegic. But the problem is his right hand doesn't work. So if he wants to eat food, if he wants to use the bathroom, it becomes a real problem. So we discussed all those kinds of things. But if there was a way to get his hand better back faster, he would have options. Maybe this can be for the bathroom. That's the answer.
So, sir, ma'am.
So I think with G Gaiter, the accessibility has increased a lot, especially for us, since you are very nearby. And coming to what next? I think upper body, it's already in line with the G Gaiter, with the Genrobotics. Does it end with just gait training and upper body? When it comes to rehabilitation, the scope is vast. It could be as simple as, if you have a stroke, I cannot see the one side of my body, one side of the field. It could be a simple sensor which tells me, okay, there is an obstacle, which gives a vibration, which prevents the fall. What I'm saying is that these are examples. It could be very small robotics. When I think about robotics, it is just some sensors with a little intelligence and some mechatronics. So it could be simple devices to entirety. That entirety, the last entirety could be a brain-computer interface with a wearable device. There are a lot of equipments, but when it comes to rehabilitation at ground level, it is very difficult to get this, especially important. So we should have something made in India. And more than that, it should not be a copy, it should be more. As Vimal has clearly told, when they started, it was like, okay, I also used to compare with Locomat. Before purchasing G Gaiter, we had actually gone and have tried both, then only have purchased G Gaiter. But now they have come up to a level in which it is far better than that. So like that, there are n number of products which we can actually make and which can actually translate the life of persons with disability. Thank you.
So there's one thing I have to add, and we spoke about this in Calicut. I think all these devices are nice to an extent. They get you a particular thing, and that's what they stop at. When they can transition into the home, that's when they become very useful. No one looks at that. So I was telling Arun in Calicut last year, where if we make a device for the hand that has pneumatics that drives the hand and makes it do functions, the next thing is a glove with a boat and cable system that allows them to go home and practice the same thing again. So now it's just bout and cables, there's a little locking system, they do the task, they keep practicing what they've gained. And no one on the market does this. So if you can provide that, a boat and cable system for dorsiflexion of the ankle, or assisted knee flexion, knee extension, after their G Gaiter, everybody needs this because no one else knows how to do the rest.
And also to connect the data back to the clinic again.
If it doesn't work, they have to come back to us, but they know how they got there.
So yeah, and now it is time for, I guess, for the audience, the engineers and all to ask questions. Guys, this is the time. You won't get another opportunity here.
I need to ask Dr. Neena, ma'am. So, ma'am, as you told that nowadays the geriatric cases are coming huge. So, what suggestion you will be giving to us, Genrobotic teams, to make a device that really focuses on the geriatrics? And I also wanted to know what are the common causes and diseases that geriatric patients are suffering.
Okay. See, geriatrics, the most important thing is falls. Okay, the falls will complicate their quality of life. Once they fall, they will get fractures and they will be bedridden and their quality of life will be gone. So what we focus more is on fall prevention. Okay, so currently what we are doing is we teach them what all things you can do at home for improving their balance, how to do modifications at home to prevent falls, all those things. But still, people continue to fall and get fractures. So you can do, if you can develop something that can help in fall prevention, that will be helpful. Second thing is they are having a lot of psychological issues because they don't have their kids along with them, also all those things. So that is the second issue. And I always used to think there was a movie, Android Kunyappan. Okay, actually it is a robotic helping a geriatric patient at home. And the future, I don't know, future may be like that because most of our young generation is going abroad. Only the geriatric people is left behind, especially in Kerala. Okay, so fall prevention would be a great area if you think to work in geriatrics. Okay.
And ma'am, one more question is that, as you said, you have a autism schools also. So the autism patients have a speech disorder also. So what's the current technology you guys are using to get a speech recovery for the autism patients?
In autism, the speech recovery is as such not possible. It is a language disorder. They don't have a normal language processing. So what we are doing is we are taking alternative communication methods. Like the current available devices there are low-tech and high-tech devices. One is known as AWAS. It is a speech and voice coming out. They can just text, the voice will come out. Or we have single switch, double switch. They will just switch on, then their need will be recorded previously, that will come out. So there are a lot of devices. These are some of the few devices that currently we are using. But each child is unique. We cannot generalize autism kids. All are not same. So you have to take each kid and you have to check what is their communications current skill. And then only you have to work what device will help that child. Okay.
Thank you, ma'am. Thanks for that.
Can I add on to that? So if you ask me what geriatric device you want, for a normal geriatric without much neurological complications, what happens is they become frail. It's more of sarcopenic, more of proximal muscle weakness. So at sometimes they will find it difficult to actually get up. And the most important is the fall. So and the next is the emotional aspects because of loneliness and all that things. So if there is a robot at home which can talk to the geriatric patient, which can help to get up, which can decrease the falls by giving cues or walking like a walking aid, assisting like a walking aid, I would love to see that. Thank you.
Thank you. Thank you, ma'am.
The issues in geriatrics is actually complex and a lot more. These are the common ones. There is a lot of reluctance in using hearing aids. There is mostly visual aids, spectacles everybody use, but hearing aids, there is a lot of. Plus the memory issues, the cognitive decline is something that people don't accept. So if, I have a simple solution. You give me a robot, I'll give you more to work on. These are areas that we can do. So yeah, one of you can come and work with us, so you can see more of personal solutions.
I believe we should do that.
And we have more of geriatric population, like people who they want to continue to be independent. So that is the most important thing that I've seen, that people still want to continue to be independent and they want to live life, in a worthwhile, fruitful manner. So you'll see many more, these dance practices. We make it a huge, we make a fuss about it. I could
literally connect with the recent movie where Asif Ali's father, like Kishkinda Gandam.
Exactly.
He wants to be independent.
Exactly.
But you don't want to give up.
You don't want to give up. Yeah, that movie was, quite, that talks about Alzheimer's kind of a situation, but still, yeah, very interesting because you want to be independent. Like I have my mother at 78, she says, if I could just walk faster, I would go without you. If I didn't have the fear of fall, I don't have to wait for you to take me somewhere. Yeah, that's the feeling they have. They used to do everything on their own, and now they need someone to help them with, doing the stuff. So that's
independence is one of the biggest freedom we can give them back, if possible.
Yeah.
Anything else? Anybody else, please? So I think there's nothing at all. So now I will wind up the session formally. So again, what I feel from this moment, like nearly we took an hour to understand and reflect on what we can do and what is necessary. So I believe these are seeds, basically, which falls across. Like Anubhav Biga sir told about the butterfly effect. This is just another butterfly effect which may contradict to bring up to a bigger change in the world. And thank you all for taking up the time and effort to. I believe you really know that is why you have all been present. So that is that's a great honor from our side and Genrobotics side. Thank you all, ma'am.
Absolute pleasure to be here.
The technological advancement implemented by these dedicated healthcare experts have significantly contributed to our collective efforts in bringing innovative solutions to the field of robotics. The next segment is dedicated to expressing our deepest appreciation for these remarkable doctors who have joined us in this enlightening conversation. Inviting Mr. Nikhil NP, Director and Co-founder, Genrobotic Innovation, to come onto the stage to hand over a small token of love and gratitude from our end. I request Nitha ma'am to please come forward for receiving a token of love and gratitude. Moving forward, inviting Dr. Ravi Sankaran, sir. Now I invite our beloved CEO, Genrobotic Innovation, Mr. Vimal Govind. Sir, please step forward. As well as Dr. Sindhu Vijayakumar. Ma'am, please come forward for receiving a small token of love and gratitude. Requesting Dr. Vaibhav Lokhande to come forward for receiving a token of love and gratitude. Dr. Neena ma'am, please step forward for receiving a small token of love and gratitude. Ladies and gentlemen, a big round of applause. Here we are acknowledging the outstanding contributions. Thank you all. Thank you all.